Informed choice. What is informed choice? Well, in our person-centered care model, where we put the patient at the middle of their own care, informed choice is one of the cornerstones of good healthcare practice. And patient, the term, is meant to be understood broadly as any person making healthcare decisions, including patients, clients, consumers, residents, and so on. When thinking and discussing informed choice, we use the Fivefingers Approach. It is a handy metaphor for us to mark and measure the content and process of ensuring that informed choice is central to the decision-making process. Of course, ethical and legal aspects support what is important to consider with respect to informed choice, while provincial legislation and our organizational policies provide valuable direction. Yet, as a starting point of the discussion, we can focus on the 5 fingers, and indeed the first finger. The first aspect to consider when pursuing informed choice is capacity. Capacity is the ability to make healthcare decisions. When assessing capacity, consider the information you have about the patient's ability to understand the condition for which the treatment is proposed, the nature and purpose of the treatment, the risks and benefits of the treatment, and the risks and benefits of not having the treatment. You also need to consider the degree to which the patient's condition affects their ability to make an informed choice. And remember, we have to assume that the patient has capacity unless there is evidence to the contrary. Capacity is specific to each healthcare decision, whether it is about what you want to eat or if you are going to have surgery. And that capacity can change over time. The second aspect, finger number 2 as it were, is disclosure. When it comes to disclosure, the minimum standard in Canada is what would a reasonable person in this patient's position want to know. We need to consider what the patient wants and needs to know about the condition for which the treatment is proposed, the nature and purpose of proposed treatments, including relevant alternatives, the potential risks in undergoing each of those treatment options, including possible harms and side effects, the potential risks and benefits in not having treatments, and the qualifications and experience of the health practitioners involved. And this also includes all information that you know to be relevant to this person that will assist them towards making an informed choice. And remember, it is your responsibility as the treating healthcare provider to give relevant information. This responsibility can be delegated, but only to other providers or learners who have the knowledge to explain and answer. The third finger is understanding. Understanding is the ability to retain, comprehend, and assess the information provided for decision-making. Does the patient understand what she is being told? Does the patient understand that he is an active participant in making decisions? And do you have the information and supports you need to help the patient understand? Remember, there are a variety of ways to support and encourage understanding, including but not limited to addressing language barriers, providing clearly written patient information sheets, letting a patient know that a loved one or friend can be present with them, responding to patient questions, asking the patients to repeat in their own words what they understand, spreading discussions over time if that is possible, and by being aware of any cultural sensitivities. Finger 4 is voluntariness. In order for informed choice to work, the patient must be able to freely make decisions. We should always consider whether there are influences on the patient that could be coercing or manipulating them to make certain decisions. If there are, how can we address these influences? And in terms of personal responsibility, what are our, as the healthcare providers, truest intentions in proposing the treatment? We should remember, it is important to consider all the pressures that are placed on a patient when selecting a treatment. This can include the influence of friends and family, as well as healthcare providers. It can also include misusing or withholding information to influence a decision or outcome. Only when all of these influences are taken under consideration can the patient freely make decisions. The final finger of our handy metaphor is choice. At the end of this process, a choice will be made. A patient will either consent to or refuse a treatment. Consider whether the patient is simply agreeing to what was proposed or whether they were actually making an informed choice about it. Ask yourself if the patient has made an informed choice, even if you don't agree with the choice. And remember, a patient's decision is shaped by their values. That choice is valid until the patient withdraws authorization, the treatment is given, or there are changes in the patient's condition and treatment options. And the patient is free to change their mind about their decision at any time without jeopardizing their health care. And documentation of the choice is important, though not binding. Use these 5 aspects, these 5 fingers, as a checklist to ensure the content and process of informed choice is at the center of the healthcare you provide. There are other elements of informed choice that deserve your attention and exploration, like substitute decision-making, where the patient may not have the capacity to make an informed choice alone or at all, and the legal hierarchy of substitute decision-makers. Shared decision-making, guided by informed choice, is a key element of person-centered care. Evidence supports that adopting informed choice will lead to improved results and better patient care.